Hello, I believe I'm live now. If you're just joining us, please put in the comments where you're from. We're going to just hang out here a few minutes until some people join us. Give folks a chance to join. Let us know where you're from, what type of facility you're from, whether you currently have therapy animal visits at your facility. Hi, Alex. Hi, Virginia. Julia, I almost called you Virginia. Or I did call you Virginia. If anybody else is on, throw a comment out there. Let us know what type of facility you're from, whether you currently have therapy animal visits, and let us know what you'd like to talk about today. We have definitely have an agenda. Oh my goodness, we have Matka. I'm sure I did not pronounce your name correctly, from Slovakia. Welcome. Let us know if you are, what type of facility you're with, and whether or not you already have therapy animal visits at your facility, or if you are starting a program to invite therapy animals into your facility. And as I said before, we're just going to hang out for a couple minutes just until people join us. Hi, Tiger. Tiger's from Connecticut. She's one of our handlers. This live is about finding and nurturing relationships with therapy animal teams. So it's really focused primarily on helping facilities find resources on our website, and that will help them kind of put together a program in their facility. And we'll just hang out in a couple more minutes just to see where everybody's from. Hi, Marion. Marion is a handler from Long Island, New York. And I just talked to Marion not too long ago. I remember talking to you. She says that she's part of the Read With Me program, and she's currently working virtually, as a lot of people are right now, kind of doing things a different way. Hi, Carol. Carol's here from Anaheim, California. Welcome. Again, if you are just joining us, please send us a comment or put a comment in on our page. Let us know if you are with a facility, if you're a handler, what type of facility you are with, and whether or not you have therapy animals at your facility yet, or if you're looking to get started with a program. Marcia is from Italy. Awesome. Georgianne is from Little Rock, Arkansas. Oh my goodness. Sonia from Portugal. We have a lot of international folks today. This is great. And Susan Steinhardt from Cincinnati, Ohio is joining us. We'll give it just another minute because a lot of things are kind of popping on here. So let's give it just a couple more seconds here. And if you've just joined, if you haven't just joined, I'm sorry you're going to hear this again, but if you've just joined, let us know if you're with a facility, the type of facility, and whether or not you currently have therapy animal visits at your facility, or if you're looking to create that program at your facility. Stephen Dickinson is from Fort Worth. Guess what, Stephen? I'm in Granbury. I'm just down the road from you. Joanna Posey from Utah. Georgianne Frazier from, Georgianne, I don't know where you're from. Becky Bishop is here from Seattle. Hi, Ashley. Ashley's one of our staff members in Arizona. We're kind of spread all over the place. Okay, why don't we go ahead and get started? Like I said, let us know where you're from. If you are with a facility, let us know what type of facility, and let us know if you already have a therapy animal team or therapy animal visits at your facility, or if you are looking to create therapy animal visits in your facility, invite therapy animal visits in. This is going to be focused primarily on facilities today, just so y'all know. Those of you that are handlers, you're absolutely welcome to stay with us, and we would love to get your perspective about this. This is kind of the other side of things. One thing that I do want to share is for those of you that don't already have a login to our volunteer center on petpartners.org, that is a very beneficial thing for you to do. As facilities, you can create a login, and there's a little icon at the top of the homepage that says login. Pretty simple. You click on that and you create a login, and there's a lot of resources that are available to you once you create that login. We have a resource library that's just full of information. And please let us know what you want to discuss today. Okay. Okay. So what we're going to do first is talk about, if my screen will switch here. Sorry, I kind of have my notes over here. So you'll see me kind of looking back and forth just a little bit. And then I'm reading the comments as we go along too. One thing that I wanted to say was, thinking about starting therapy animals visits at your facility might be a bit daunting during COVID. The pandemic has definitely impacted the way that we're able to provide visits. We are seeing some person-to-person or in-person visits starting up again. In the United States, those are starting up slowly, but they are happening in some places. And so it feels good to know that things are sort of moving in the right direction. Internationally, I'm not sure exactly what's happening in your countries. And so those of you that are international, let us know if you're doing in-person visits right now. That'd be interesting, I think, for everybody to see. COVID does, even though it's impacted the way we're providing visits, it is a good opportunity for those of you who are working on maybe starting a therapy animal visit program. This is a good time for you to do some of that planning and research and get your ducks in a row, so that you just kind of have some extra time right now to work on that. Something else is that we do have some resources that we'll talk about throughout the presentation for alternative type of visits. And that is something that folks have been most interested in, is how do we keep this human-animal bond going when we can't even get through the door or can't invite people into our facility. So we'll be touching on that. As most all of you know, or else you probably wouldn't be on this Facebook Live today, there's a real value in when that human-animal bond happens. There's some real value that comes from that. There's research to show that there's physiological effects from that human-animal bond. There's an increase in hormones that regulate things like blood pressure and stress and anxiety, and actually impact a person's mood. It impacts how much joy they may feel. It's a motivator for people. It encourages people in healthcare facilities. It encourages people to participate maybe in their treatment plan. Maybe they weren't doing so well being compliant with their treatment plan, but because of this change, this physiological change and kind of their outlook, we see a difference in the way they interact in their treatment protocols. Also, it helps decrease social isolation, which is hugely important during this time of the pandemic. Social isolation is something that's been discussed a lot and has impacted pretty much every person in the world during this pandemic. And for those folks that are residents of, say, a nursing home or assisted living facility, many of those folks have not even been able to get visits, as you know, from family members. So being able to provide maybe a window visit at a nursing home helps those residents not feel quite so socially isolated. It helps them feel connected with the outside world. And for folks that are involved in, such as our Walk With Me program, it gives them encouragement to get up and move. So it's a great motivator. Or a Read With Me program, it helps students improve and practice their reading skills. And so it's a motivation for them that they may not otherwise feel if they're having to read in the classroom. Just to kind of set up some basics here, I want to talk just a little bit about what constitutes a therapy animal visit. So, a therapy animal visit, a pet partner's therapy animal visit, is one volunteer and one animal. They make up what we call a therapy animal team. So, the volunteer is often called a handler. That's how we refer to them, as handlers. And the handlers are typically owners of the animal, but they don't have to be. A handler can volunteer with a friend's animal that is just very well suited for this type of work, as long as we have consent from the owner. And then something else to keep in mind is Pet Partners is one of the few organizations that actually registers species other than canine. So we register 9 different species, and the reason that we feel comfortable doing that is because of the research behind the behavior of these types of species. We're able to quantify that behavior and evaluate on that behavior and feel comfortable then having those animals represent Pet Partners and come into your facilities. So the different species, and I'm going to cheat here because I'll forget one or two if I don't cheat. Dogs, of course, they make up about 94% of our therapy animal teams. We also do cats and horses, birds, pigs, llamas and alpacas, rabbits, rats, and guinea pigs. So, might be some surprises on there, but we pretty much have all of those different species represented by our 13,000 therapy animal teams that we have registered. Pet Partners visits are up to no more than 2 hours per day, and they're on a volunteer basis only. We don't charge for therapy animal visits. It's strictly volunteer. And as when those that criteria is met, then our handler or our therapy animal teams, our handlers are covered by comprehensive general liability insurance should something happen during a visit. And that's important to know as a facility for sure. Our registration process includes handler education. All of our handlers have to first take a therapy animal handler course, and the handler course goes over things like what to expect during their team evaluation, what to expect when they go for a visit in a facility. There's an entire section on visits in facilities and how to conduct themselves. And we also talk about things like proper infection control, proper hand sanitizing. And we'll get into that just a little bit later. We also require a current animal health screening form to be completed by the animal's regular veterinarian. And then a team evaluation by one of our licensed Pet Partners team evaluators. And that is a series of exercises that a handler and their animal go through to just basically verify that they are able to do this type of work out in facilities and that it will be safe for them to do so. We introduce a lot of things that many animals are just not used to. For instance, we introduce, a wheelchair into the environment and see how the animal reacts to that, or loud noises, or something that we call clumsy petting, because not all animals are used to they're kind of used to being handled in a certain way, and along comes somebody who maybe kids and others who maybe have never really been around this type of animal before, and they may be a little clumsy in their interaction with them and pet a little harder than the animal is normally used to. So we want to test for that and make sure that they're okay. And then finally, we run a background check also. So even though at your facility you may run a background check on all of your volunteers, just know that all of our new therapy animal teams and renewing teams have to go through the background check process. Okay. So for facilities who are either kind of reevaluating their program or starting a program, we have an entire page dedicated to you. And it is just a comprehensive resource of different links and different materials that will help you in this process. When you go on our on our website, and Julia is actually going to provide the link to this in the comments. When you click on the volunteer tab, you'll get a drop down box, and there will be a link for pet partners at your facility. And I promise you, it will have virtually everything that you need to when you're trying to develop your program. There's a facility toolkit. You can click on a link to download the facility toolkit, and it's one of those sort of full-fledged resources. Everything is in there that you need to help you through this process. And a lot of what I'm talking about today, I pulled out of the facility toolkit. Let's see. There is also a link for virtual therapy animal visits. As I said before, when COVID hit, we had to rethink how we were doing things, and we had to help our handlers prepare for sort of this weird interruption in in-person visits. And so we've created a virtual therapy animal guide, and we've created one for handlers, but also for facilities. So facilities can think about providing that human animal bond in a totally different way as well. So some of the things that are in there are things like window visits. When a therapy animal team comes to a facility and does, I'm sorry, I'm so distracted right now because there's two road runners that keep running in front of my window. I'm down in Texas and they keep running in front of my window. They're never here, but during my Facebook Live, they're interrupting my Facebook Live. Okay, back on track here. They're paying me a window visit, I guess. I don't know. So what happens is often is that some of our therapy animal teams will they'll make signs that say, we're thinking of you, or, we love you, we miss you, that kind of thing. And they post or they stand outside the window at the nursing homes or residential areas, or if it's a healthcare facility, maybe stand outside the window at a ground level clinic or cancer center, that kind of thing. And it's just something very uplifting for the people inside. They've also done animal parades. They do those, think about the staff members that are used to having these therapy animals. And for the past 6-7 months, they haven't seen them because they haven't been allowed in the facility. So they do animal parades outside the facility where everybody has their masks on and they're socially distanced, but the staff at least get to see the animals that they've come to love. Some of our teams have made cards. They've made cards from their animals and sent those to facilities that they regularly visit, and that's just awesome too. There's also in the virtual guide, there's technology links for video equipment and software such as Zoom and Skype. It's really not, it seems overwhelming if you've never done it before, but it's really not that difficult. And that creates a two-way interaction then for people that are behind the walls that can't be visited. And then finally, we also have a Therapy Animal Visits with Pet Partners Facebook page. And I would highly encourage any of you to go and join that page. Again, it's called Therapy Animal Visits with Pet Partners. And you have to request to join, but just let our staff know why you want to join, and we'll be happy to add you to that page. I think we're up to like 1,800 people on that page, I believe. And there's example after example after example of alternative ways to visit during this pandemic. So it'll give you lots of ideas to choose from. Okay. And by the way, I did want to say too, Julia will be answering some of your comments. I'm sure you've seen that already in the comments area. So if you have questions, she'll be reaching out. And then here in just a little bit, I'm going to stop and kind of scroll through some of those comments and try and answer some of those live. If I don't get to all of your comments, please know that we'll answer those through Facebook or by sending you a message. Or you can always use the Contact Us button on our website, and you can reach out to us and contact us in that way. Okay, we also have an area where you can post your volunteer opportunity. So you have the ability on our Facebook page to tell us about your facility, post your opportunity, tell us what kind of species you would like to have come to your facility, and the type of population that you have, lots of demographic information. And our volunteers, our handlers, go out periodically and search those volunteer opportunities in their community. They can narrow it down by a zip code search and do a radius parameter. And so your opportunity will stay out there for 6 months. That's one caveat to posting it. You have to go back out and repost it every 6 months because it's kind of the only way we can keep that clean. Another thing that's on Pet Partners at your facility is animal assisted intervention for professionals. So if you are a professional who is using your animal in practice, in your practice, check out that page and click on that link that will take you to our AAI for professionals, and we'll give you a lot of information and introduce you to some other specific resources there for that type of work. And then we also have information about a sponsored visit program and or our premier facility program. So when you post your volunteer opportunity on our Facebook page, it is up to handlers to seek out those opportunities. At Pet Partners, we're focused on getting those therapy teams educated, evaluated, and ready to go. Okay. And we're a very community focused, grassroots oriented organization. We expect our handlers, our therapy animal teams to go out and find those facilities in their area that they might be interested in and approach those facilities and see if they're interested in receiving therapy animal visits. So we don't usually take that extra step, mostly because we don't have the manpower to do it, to link up facilities and therapy animal teams in other ways. Another way to do that is through the sponsored visit program and the premier facility program. For a donation, corporations, for example, can reach out and request therapy animal teams through the sponsored visit program, and we have a staff member who is dedicated to spending some extra resources trying to match up therapy animal teams for that. Other resources that we have for facilities, this is not necessarily on our Pet Partners at our facility page, but is within our resource library, is our handler guide. You can find that in our online store if you want a hard copy, or you can find it in the resource library if you want a PDF version. The handler guide is a great resource for facilities because it is the booklet basically that comes along with the therapy animal handler course. So it's what our handlers are learning to be in preparation to come into your facility and make visits. So it's nice to kind of be on the other end of that and look at it, know what they have to go through to be able to come to your facility. We also have we do have facilities who actually register and purchase the therapy animal handler course. It's $70, and you're welcome to do that. Even if you're not pursuing therapy animal registration, you're welcome to take that therapy animal handler course. It's well worth it. We have other coursework on our website that is kind of topic specific, like infection control. So our handlers can get more information on infection control, and you can too. We also have information about, we have a canine body language class. We have information about working with special populations. So if you're a facility that has a lot of residents with dementia, memory care, there's special education for people coming into your facility in working with those populations. We have that for veterans as well. And then, like I said before, the resource library, once you create an account in our volunteer center, the resource library is just a ton. There's just a ton of information in there for you. So let's take a bit of a break. I'm going to scroll back up through the comments. So forgive me while I kind of get distracted here for a minute. And I'm just going to kind of go through the comments and see who else we have here. Lynn coordinates the Paw Prints program at Boston Children's Hospital. I love the name of that. Paw Prints is so cute. Donna Jackson is down the road from me in Hutto, Texas. Carol Ann is asking if she can get a copy of the, let's see, what is it? The facility, Pet Partners at your facility. And as I said, that's not really something that we can make a copy of, that's a link to a lot of different resources that you can access then and you can download. Like when I was talking about the facility toolkit that's found on that page, that facility toolkit, you most certainly can download that and print off a copy for yourself. Okay, Trisha, I'm sorry that you had trouble joining us, but we're so glad that you're here now. And Trisha, the Facebook page that I suggested that you join is called Therapy Animal Visits with Pet Partners. If you just go to the Pet Partners main Facebook page, you'll find the Therapy Animal Visits with Pet Partners as well, or you can search it by its title. Aha. And Julia just popped that link in there for you, so you don't even have to go search it. Okay, that's the end of our comments there. So let me get back to a little bit more information. And by all means, if your facility sitting out there and you're wondering, you have a question that you want to ask us, please throw it in the comments. So this next section I kind of call Not All Fun and Games because my background, I've been with Pet Partners for a little over a year now. My husband and I previously lived in Illinois, and when we moved to Texas, I was lucky enough to be able to work for this wonderful organization. And it was kind of right up my alley because in Illinois, I was a director of volunteer services at our local hospital for 20 years. And about 5 or 6 years ago, I started bringing therapy animals into the hospital. And when I had heard about that for years and years and years and always wanted to do it, always got a little bit of pushback. And there was a little change in our administration to the point that I felt like the time was right and I could do it. And I thought that everybody would be, the reason I call it Not All Fun and Games is because I thought everybody would be as excited and on board with it as I was. And I found out that's not always the case. Sometimes you have to really sell this program. And once it got started, though, it was great. And even the naysayers, which were very few, could see what a benefit it was to our patients. So, excuse me, I want to give you kind of some tips just based on my experience of some things to prepare yourself for. So, first of all, I was so surprised that people didn't really understand what therapy animal visits were. So be prepared to explain and educate yourself. There's information on our website about this as well in the resource library about what are therapy animal visits, what makes them different from service animals. They're not service animals. Service animals serve a purpose for the person that they are serving. Therapy animals visit, their attention is outward. A service animal and an emotional support animal's attention is inward to, or is focused on the person that they are assisting. Okay. Focused outward toward the person that they're visiting, not the handler as much. And it's not family pet visits. I was so surprised because a lot of people, I had several people say, well, we can't let our patients' pets come to the hospital. I was like, well, that's not what this is about at all. So be prepared to share or to explain what it is. Also, be prepared to explain to your colleagues that what a Pet Partners visit is. It's volunteer visits that are up to 2 hours a day. They're seeing patients, or they're seeing residents, or they're visiting with students if this is a library or a school as your facility. And be prepared to explain that to them. Also, speak to what's important to each individual. And what I mean by that is, as you're trying to sell this program to those people that you need to sell this program to because they have important positions at your facility, be prepared to speak to what is important to them. So if you are talking to your infection control folks, talk to them about the fact that we educate our handlers on proper hand washing, that there will be consideration and policies written about how those visits are going to be conducted in a safe way in terms of infection control. If you're talking to risk management, talk about the fact that we provide comprehensive general liability insurance to our handlers. So they know that there's at least that first layer there that will make them feel much more comfortable. If you're talking to nursing or if it's not a healthcare facility, anyone in administration, talk about how it will increase patient satisfaction or customer satisfaction. Also, be prepared to explain why it's beneficial. We talked about before how that human animal bond produces an increase in hormones that are related to blood pressure regulation, and it decreases stress and anxiety and produces a feeling of joy. That's important to people, especially in healthcare environments. It's very important. It provides motivation for them to participate in treatment. We talked about that before. And so you can kind of speak to those things that will be important for your particular customer. If you're a library, you can talk about the benefits of having therapy animals in so that your students can read to the animals and improve their reading skills. Find what's going to be important. And then talk to them about, when you're making your presentation, talk to them about what a visit is going to look like in your facility. But remember, you've brought some of these key stakeholders to the table. They're going to have their own ideas based on their expertise. You've brought them to the table because they have their own area of expertise that they're representing for your facility. So when you start talking about your version of what a visit's going to look like, you may have to compromise a bit. They may put some parameters on your visits that you weren't expecting, and just work with them and compromise a bit. Everybody needs to feel comfortable. I just can't tell you how crazy some of the responses were when I said, yes, we want to take therapy animals into a patient room, and people were like, what? I was amazed by that. I thought everybody knew about therapy animal visits. We just didn't do it at our hospital yet. And then the other thing, I highly recommend you start your program small and grow it from there. Start with a pilot program, only have like maybe 1 or 2 therapy animal teams that you get to know well and that you can work with to try and develop your program as you go. Have your basics and then develop your program. One thing that we found out in our hospital program was the need for an additional volunteer to go with the therapy animal team. We needed to have them carry the clipboard. The clipboard contained a pre-qualified list of rooms. Our charge nurse would actually go around and ask patients on appropriate patients on a floor whether or not they would like to have a therapy animal visit, because we didn't want to just show up at a room. We wanted to pre-qualify them and not bother them if they didn't want to have a visit. And so they would give that to us about an hour or so before the therapy animal team would arrive. And so that volunteer would carry that clipboard and would be in charge of knowing what next room we were supposed to go to. They would also carry the hand sanitizer that we had to carry around, because our handlers are supposed to use hand sanitizer before and after a visit. And the people who are going to be touching the dog, meaning the people who we are going to be visiting, but also anybody who's in the room that wants to interact with the dog, has to use hand sanitizer before and after as well. Let's see. Another thing is key stakeholders to invite to the table. I kind of used that term before. So if you're in a library, for instance, a city library, and you want to start a Read With Me program where therapy animal dogs are brought in and kids can read to the animals, then you're obviously going to want to include the library director, unless you're the library director who's wanting to start the program. You'll want to include your library board, anybody who is responsible for risk management at your facility. And so just think about those people who are going to maybe have some input and make an impact, and invite them to the table. With schools, I would assume it would be getting the principal on board, school nurse for infection control, your risk management folks, and think about where you're going to have these visits. If these visits are going to take place in your school library, then, and it's not the library director who is kind of facilitating the startup of this program, you definitely want to get that person involved. And in healthcare, um, definitely nursing administration, infection control, and risk management for sure. And if you are not a volunteer director, most likely you're going to want to get that volunteer director involved, because the therapy animal teams coming into your facility will be considered volunteers. And we even have badges. You know, of course, all of our volunteers have badges, but we had badges for our animals too, our dogs in the program, and it was really cute. So you'll want to get those folks involved too. And then finally, you know, nobody likes writing policies and procedures. Well, I shouldn't say nobody. I hate writing policies and procedures. I suppose there are some people that maybe like that stuff. I don't know. But I didn't. And so, you know what? I reached out to hospitals in our state association, and I belong to a national association as well. And I said, can you send me some samples? And they were more than happy to share samples. I actually had a sister, well, not a sister hospital, but a hospital in Illinois that was part of our state association. I mean, I even met with that director of volunteer services, and we spent an entire afternoon just talking about her program, and it was so valuable. So people love to talk about their program, and they love to share. Excuse me, just a minute. Apologize for that. Kind of came out of nowhere. And then one more thing that I want to talk about is in this segment is, and then I'll get back on some questions, is the retention of therapy animal teams. Definitely, once you do all this hard work to create this program and you get teams committed to coming in, you want to keep them. So you want to make sure that they feel comfortable, they feel welcomed, that they know that they're making an impact and they're important. They have other places they can go. Excuse me. I think the air is really dry in Texas today. They have other places they can go. So you want to keep them coming back. You always want to create an inviting space for them. What we did was give them a consistent spot to check in, which of course was my office, because I wanted to see them every time they came. It was fun. Those were great, great days. The staff at your facilities will definitely be impacted by therapy animal visits as well. So you want to provide a consistent place for them to check in, have a water bowl ready, filled up and ready to go. Make sure that you discuss a place for them to potty. So, I mean, it happens. They've had a long car ride, and sometimes they need to go outside and potty before they go up and make their visits and up on the floors. And just make sure you have some supplies as well. They should have supplies with them, but not everybody, you know, we all forget things from time to time. Excuse me, I'm so sorry. You also want to educate. You want everybody in your facility to kind of know what's going on. And I know that's hard in large facilities, but the more your staff know what to expect, the better. Julia's going to post a link in the comments for a resource in our resource library called Flyers, Posters, and Handouts. And there are handouts for facilities that you can tailor to your particular facility. You can use those in a lot of creative ways, letting people know that you are going to start therapy animal visits. Also, make sure that your volunteers are oriented so that they know how to conduct therapy animal visits. Make sure that they know about proper hand sanitizing before and after each visit, and where they can go. Take them around your facility so that they know for sure what areas they can go to and what is off limits. The worst thing that can happen is if they wander into an area that's off limits to them, and then someone finds them and there's a negative interaction. It's going to make them not feel comfortable in your facility, even though you weren't really a part of that. And then a lot of facilities are mandated to do this, but even for facilities that aren't, it's important to revisit those policies and procedures each year. It's important that they get a reminder of what they can do, what they can't, and how you expect them to conduct themselves during therapy animal visits. And then, of course, celebrate. You want to think outside of the box of how to include your therapy animal teams in celebrations, whether it's volunteer appreciation events or including them in staff celebrations. If you have all staff meetings, invite your therapy animal teams to come so that the staff can get to know them and see them. This, of course, is after the world becomes a little different and we can do in-person things again. That day will come. And then finally, this is certainly not expected at all, but one thing that some facilities do is they cover the cost of registration. There's a commitment on the part of our therapy animal teams to get registered. And so that's a really nice way to do a kind of a thank you and a give back to them. Okay, let me grab a quick drink again. I'm so sorry. And I am going back up through the comments, just going to kind of cruise through here a little bit. You guys are asking some good questions, and I see Julia is taking care of those as they come along. Tiger says it's a nice idea to meet with the team first. It helps them and also the animal. That is definitely true. What we recommend a lot of times is that the handlers, you as a facility, you invite your handler in first so that you can sort of go over what's expected of any volunteer in your facility. And then at some point, definitely invite the animal in with the handler. If you want to do that up front, that's okay too. It's your facility. You get to decide how to do that. Lynn Belkin, it says, do you know if or where any in-person visits are taking place? Do you know of any hospitals that are allowing volunteer dogs at this time? I don't know of hospitals that are. I do know of some other facilities. I can't really recall them off the top of my head, but we are seeing some. We have a feature on our website called Log a Visit where our therapy animal teams can log their visits that they make, and we are starting to see those pick up. They were a lot of those visits were just virtual visits for the longest time, and a lot of that, we're still getting a lot of those, but we're starting to see the in-person visits come in. I don't know that any of them have been from hospitals yet. Keep in mind that even if it's not an in-person visit, they could be doing staff visits out, distancing in a parking lot. What we're telling all of our therapy animal teams is that they must follow the COVID restrictions for their particular area because the country is so diverse right now with what's allowed and what's not allowed. And of course, our therapy animal teams have to decide too, the handlers have to decide if they're even comfortable doing any type of visits right now. And if they're not comfortable, that's totally their choice. Okay, let me go backwards a bit. I just want to make sure I didn't miss anything up above. Okay, we got the Facebook page. Okay, Susan Steinhardt says some school districts require approval by the Board of Education. Very good. That's kind of not my area of expertise, Susan, so I really appreciate you sharing that. And she says also we're finding that many facilities are not allowing volunteers who are older than 60 due to COVID. So all of what I'm talking about today, is it's kind of flexible based on where you are. We felt like even if in-person visits weren't happening on a regular basis, this was good information for you to start developing that program. Okay. Whoops. Diane is the AAI, which is Animal Assisted Intervention Coordinator at University Hospitals, Cleveland, Ohio. Any idea when you'll let the teams back into the hospitals? That's a great question, Diane. Pet Partners never put a moratorium on visits. We never said you cannot make visits. I think that may have happened with some other therapy animal organizations, and that was their choice. That's fine. We left it up to our handlers to make sure that they followed the guidelines for their particular area. And definitely, there was a period of time, probably through like April, May, where I don't think anybody was probably visiting anywhere. Things got very quiet. And that's when the virtual visits really started kicking in then. But as far as in person visits, we never said they couldn't. So if that's something that you're interested in, you could reach out to, if you have Pet Partners Therapy Animal teams, you could reach out to them and see if they're comfortable making those visits and how your infection control procedures might be different during COVID. Just know that all of our handlers, again, have their own health risks. And so they may not want to be doing visits based on, their age, their health status, and that kind of thing. This is great. Jan Nowicki said, that she shared an idea. She said the hospital we visit struggled to find staff and volunteers to escort. So that additional person that I was talking about to go along with. She said we stumbled on some staff who were tied to desks and phones. They worked out a rotation schedule for time away to help us. What a wonderful thing your facility did to allow their staff members to go and escort those therapy animal visits. Can you imagine how nice? That is a wonderful gift to give to staff members. Talk about employee appreciation. Okay, Tricia said, do you have guidelines for groups that hold events in different locations and want some teams with them? And it looks like that Julia answered that already. Our teams are not currently suspended from visiting, like we had said before. And so it really just depends on, what's going on in your area of the country. Okay, Lynn Belkin says they're doing Zoom-based visits and they are very impactful. They are. We did some research into animal related engagement, and really any interaction at all with, and if you go on the Pet Partners website, on the main page there's some scrolling pictures, and one of them is it says animal related engagement, and I recommend that you click on that and read some of the information that Dr. Taylor Chastain on our staff put together. It's incredible the impact of just a child reading to a stuffed animal. There's benefit even from that kind of interaction. Okay, some facilities offer window visits. Yup. Okay, it looks like I've gotten about down to the end. So just kind of in closing, but if you have any more questions, please pop them in. And thank you, Julia. Just put a link up for animal related engagement. So in wrap up, we're at about 50 minutes now, so I'm going to wrap this up pretty quickly. In inviting teams, don't forget you can post on our Pet Partners website. Just remember that teams have to actually go look for those opportunities. What you might want to do is, we consider ourselves a very community-focused, grassroots-oriented organization. Get some flyers and posters out in your community. When you're ready to invite teams to your facility, whether it be through virtual visits or through in-person visits, get the feelers out. There may be therapy animal teams in your community that you don't even know about, and it could be teams who don't check the volunteer opportunities regularly because they're already kind of engaged. And so get the word out in your community. You know your community best and know how best to do that, but we do provide you with some resources to do that. And Julia just posted that link again in case you missed it before. Missed it? What's that? That's what happens when you've talked for a long time. You can also host an informational session when you can actually gather people together, or you can do it via Zoom. Host an informational session for prospective volunteers. Cast your net, see what happens. It's like any other volunteer that you would invite to your facility. Think about how you recruit for those and recruit for therapy animal teams. I was shocked at how many teams were in my area. When I started kind of looking around. And if you don't have therapy animal visits right now, once you're able to find one or two teams, those teams know other teams. They have kind of a network going. You can host a team evaluation at your facility. Our evaluators are always looking for places to hold evaluations, and it can be kind of difficult in some communities. So if you have a nice large space, when we're able to be in person again, you might want to consider hosting a team evaluation and just be creative and get the word out. If you have specific questions about some of these things I talked about that we didn't get to on the Facebook Live, definitely use the contact us button on the website. My job at Pet Partners is program support coordinator, and Julia Heath is the other program support coordinator. And so when you use the contact us button, we answer those inquiries as quickly as we possibly can. She and I both are monitoring those on a regular Monday through Friday basis. We also have phone support hours. You can call us Tuesday through Friday from 7:30 a.m. to 1 o'clock p.m. Pacific time. So feel free to reach out to us. We do have voicemail, so you can leave us a message and let us know what time would be best to get back to you, and we'll be happy to do that. Okay, let me look here real quickly. Looks like we have some ongoing conversation that's going to be kind of handled outside of the Facebook Live, and that's good. Some good detailed information. And Donna Jackson says she's planning on doing a Zoom with a Girl Scout Daisy group. How fun! All right. Well, that takes us up to about 53 minutes, which is kind of a long time for Facebook Live. As I said, I encourage you to reach out to us if you have any further questions today. Bye bye.